to improve genetic selection. The major goals are to improve genetic selection. We can select an elite donor female or elite males and multiply them very quickly. It also use this to enhance reproductive efficiency by synchronizing estrus, and we can maximize the production of offspring with desirable traits through embryo transfer. So we can use those high females, replicate them, and put those embryos into our lower value females as surrogates or recipients. So to kind of start us off, I wanted to define what is reproduction. It's defined as the production of offspring by a sexual or asexual process. So in goats, that is a sexual process, and they are seasonally polyestrous animals. So they have multiple estrus cycles within a year, but it's within that defined period. It's within the fall, usually from August through March, and they cycle every 21 days, starting at about 6 months of age once they hit puberty. So there are two distinct phases of the estrus cycle. We have the luteal phase and the follicular phase. The luteal phase, that's predominantly when those animals, you're not seeing any signs of heat. It's got progesterone as our predominant hormone. There's a CL present on the ovaries, and it's about 17 days in length. Then we have our follicular phase. This is when that corpus luteum dies off. We see maturation of follicles, and then we start seeing signs of heat. And estrogen is our primary hormone during this time. So when we kind of put that together, we can kind of see on this graph, within that 21-day period, progesterone, or P4, is the highest elevation and has the most time frame within our estrus cycle. So that's the most predominant hormone. Then during those last couple days before we see that onset of heat, estrogen starts to rise. And then as estrogen peaks, we have ovulation. So I kind of wanted to go through today those basic hormones, what they are, what they do. So those hormones are progesterone, estrogen, prostaglandin F2 alpha, FSH, and LH. So starting us off with progesterone. Like I said, that's the predominant hormone present in the estrus cycle, and it's essential for normal reproductive cycling. It's produced by the corpus luteum, and it suppresses signs of estrus and blocks ovulation. Our next hormone is estrogen. That's produced by our follicles on the ovary. It increases in concentration in the blood as the follicles mature and that dominant follicle emerges. It causes external signs of heat, like we all see as producers, flagging, red vulva, the willingness to be bred, and any other signs you might see during that 24-hour period of heat. Then we have prostaglandin F2 alpha. This is released from the uterus itself. It is used when there is no pregnancy for the dam to recognize, and it causes that CL to regress, also known as luteolysis. It causes that change from progesterone being the highest to start decreasing and allows estrogen to start increasing. It then triggers for the growth of follicles into a dominant follicle, which then allows estrogen to become that highest hormone within the body and initiate estrus. Finally, we have follicle stimulating hormone. This is produced by the anterior pituitary gland, which is in the brain. It supports the growth and maturation of follicular waves. And in higher levels of FSH, we use these to superovulate our donors. This allows for multiple follicles to be recruited within small ruminants, especially since they normally have 2 or 3 follicles normally. This is when we could start seeing upward numbers of 8 to 12. And these are then allowed to mature into dominant follicles when we use this for flushing. Our next hormone I wanted to talk about was luteinizing hormone. This is produced by the anterior pituitary gland as well. When there's a rise in LH, it triggers that female to be ready for ovulation and for development of that corpus luteum. Finally, there are some minor hormones like inhibin. This regulates the production of FSH. In a normal doe, this is what keeps them from producing from that cohort of follicles, only having 2 or 3 becoming dominant follicles that ovulate. Otherwise, they would have as many follicles as that ovary can recruit being ovulated, and we would have a pregnancy that's non-sustainable. Another hormone that's minor is gonadotropin releasing hormone, also known as GnRH. As progesterone decreases, GnRH levels increase, which triggers the release of FSH and LH. When we use synthetic GnRH, like cisterellin, it acts as an LH component, which helps that body trigger to induce ovulation. So let's kind of put it all together. In this graph, you can see as day 0, that's kind of when we start off. That's when ovulation occurs in our previous heat cycle. There's a decrease in estrogen significantly, and progesterone starts to rise. Progesterone rises over the next 17 days, and estrogen kind of stays pretty low, pretty stagnant, and it starts increasing at that day 16, 17 mark. And then over that time period till about day 21, we see a significant increase in estrogen, which is due to prostaglandin F2 alpha hitting that CL and causing the CL to lyse, and progesterone decreasing. Progesterone's our gatekeeper. It keeps estrogen at a low level. So when that starts to decrease, estrogen becomes significantly higher, and we see those dominant follicles be recruited, and finally ovulation. So let's put it all together once again. So that was just the hormones. This is what's happening on the ovary within those animals. So as you can see by the green line, that's progesterone. Like I said, that's our gatekeeper. That's the most dominant follicle you'll see in any estrous cycle within an animal. During that time period, as you can see, there's multiple follicular waves that are occurring on that ovary. Follicles are recruited, they grow, but since progesterone's still high, there can't get enough estrogen for those follicles to grow to full size, so they become atretic, or they die off. Usually in small ruminants, there's not a whole lot of research, but they're more three-wave type animals. So like in this graph, you can see takes 3 recruitments of follicles before that finally progesterone decreases and that dominant follicle can grow. So when we take this, we can then use what's going on in the ovary and use that for estrous synchronization for both AIs, for flushing, for embryo transfer, and so on and so forth. So what is the goal of estrous synchronization? We're taking a group of animals and we're syncing them up with their heat cycle and allow them to be bred together. This allows for a producer to plan for when the parturition is going to occur, how they can improve efficiency with keeping groups of animals the same age, and they can manage those pregnant does better. They're not having does in different stages of pregnancy or lactation, and allows that producer to have efficient nutrition and management of those groups and keep a consistent group. How can we do estrous synchronization? There's multiple methods. We have the buck effect, which is just introducing a buck to those does, and then it syncs those does up once he's introduced within 2-3 days, but it doesn't get as many within that group as we would like. There's also artificial lighting and melatonin. The use of prostaglandins like luteolise and estromate. When you use that within a group, you get about 80% of that group with a single shot to come into heat. Or we can use progesterones like cedars mixed with prostaglandins to have at least 90% of your group estrus sync together, or to allow you for timing for AI or use with embryo transfer. So these are the common drugs that we use with estrus synchronization. We use cedars, we use estromate or luteolise, PG600, and cisterellin. So our cedars, that's our source of progesterone. Estromate, that's a cloprostenol, that's also a prostaglandin, so that's our PGF2 alpha. Our PG600, that acts like a small amount of FSH, but it's mostly an LH component. And then cisterellin, which is our GnRH. So when we add those onto our graph here, we can kind of see where they act. So like I said, cedars act as progesterone. When we leave those in for 14 days, we're basically mimicking the life of a CL. We're keeping progesterone high, not allowing those follicles to get too big or become dominant follicles, and suppressing estrus. Then towards the end of our cedar life, we then use prostaglandin F2 alpha or estromate. This lyses any CL that may be on that ovary, or when we go to pull that cedar, we see that shift from progesterone decreasing and allowing estrogen to increase on its own naturally. And finally, we have PG600, which kind of has that FSH and LH component. That allows us on that third follicular wave, when we give this at the time of cedar pull, to allow FSH to be stimulated and recruit multiple dominant follicles, not just the couple follicles that, or one or two follicles that that doe may have on her own. We may see multiples, upwards of 3 or 4. Finally, GnRH is a component we also use with cisterellin at the end of a protocol. Usually this is given 30 to 36 hours after cedar pull. This ensures ovulation. It's mimicking ovulation with that surge of FSH and LH, and ensures that any follicle that's ready to be ovulated ovulates, and that we have that timing with AI. So how do I apply this to artificial insemination? So artificial insemination, whether it be transcervical AI or vaginal AI for some producers that use fresh semen, is the most basic form of assisted reproductive technologies that we can use. So this is the easiest one anyone can use on their farm with just a little bit of training. Doesn't require any special application. So we use those synchronization schedules. With that, there are a lot of different variations, but it allows us to time up that doe in her cycle and dictate what time is best within your herd of when we can AI and to group our group of does together. You can work with a veterinarian to decide what protocol is best for your herd, but there's lots of different variations. Use of different drugs, how long that cedar's in, if we use PG 600 or not, or different variations within that as well. And then there's many synchronization schedules that are also used for cattle that work for goat. The Reproduction Task Force out in Nebraska is a great source for all these different types of protocols. So I kind of have on this slide a bunch of different protocols that are used. We can have as extensive as a 7-day co-sync with a cedar. So that cedar's in for 7 days. Then we give PG F2 alpha at the end, and then wait 54 hours and AI with use of GnRH. Or we have ones with PG 600, which become a little more intensive, or we can have them as simple as 2 shots of prostaglandin. You give her the shot of lute, like I said before, about 60 to 80% will respond on that first cycle, and then you wait 10 days and you give a second shot of lute. This will sync up the majority of your group, and then you AI off that second heat. So once you have your synchronization protocol, then we rely on producers to have estrus or heat detection. So a lot of people know this as the behavioral signs we see for estrus are bleeding, flagging of the tails, the reddened vulvas, the discharge, and the riding of other does. Typically, standing estrus lasts about 36 hours, but it ranges anywhere from 24 to 48 hours. No 2 does are the same, no breeds are the same, and age and season and the presence of male goats really play a role into how long that cycle lasts. For example, Alpines usually have a 31-hour estrus cycle versus Nubians at 42 hours. So knowing your goat and their breed and kind of their history really helps align when you want to AI with that animal for a transcervical AI. You can also use cervical mucus. You will see a shift from clear and thin mucus at the onset of estrus to kind of stringy, we call it striate, or it's got like little white streaks in it, which happens at mid to late estrus. This is when insemination should be performed, when that mucus starts to turn cloudy, typically 12 to 15 hours after onset of estrus. And picture number 3, that's about the best time you can have when you can artificially inseminate at home. When you start getting down to the later stages of estrus, like demonstrated in pictures 4 and especially 5, at that point, the cervix is starting to close. It's not easily passed, and you start missing your ovulation window at that point. If you go earlier, your semen may not live long enough, especially when using frozen semen. So you kind of really want to time it out so where you're starting to get towards the end of their estrus cycle, but still have enough time to get through that cervix. So like I said, when you start seeing that, it's time to AI. You're going to thaw your semen, put it in your gun, and go through those cervical rings and inseminate. Now, if you don't have time at home or don't have the skill or don't want to try inseminating on your own, there is another option. Laparoscopic AI is always an option, and that's when semen is inseminated directly into the uterus. This typically is better for producers that want to do a large group, they don't have time to heat detect, or are using very rare semen. With laparoscopic AI, we can typically yield higher pregnancy rates, ranging about 60 to 70% conception rate. It requires also less spermatozoa to achieve fertilization. So like I said, this is a better use for frozen semen. Most of our straws collected by processors usually have about 50 to 75 million spermatozoa that are live. That's when that semen is fresh. After freezing, we start seeing death of those spermatozoa. So when we have a motility of only 40%, you're really, or even 50%, you're at that 20 to 25 million live spermatozoa. So that's the ideal number for laparoscopic AI versus transcervical. We really like to see 75 to 100 million live spermatozoa in order to achieve pregnancy. Now, if you want to get more in depth and you want to use an elite female and replicate those, embryo flushing is always an option. We take in our elite donors. We can have ones that are milking 4,000 pounds, bucks that are on the elite list or produce high producing animals, and we super ovulate them with FSH. We're recruiting numerous follicles. And then we traditionally follow that up with a surgical procedure to recover those embryos. Donors are sedated, they're placed under anesthesia, that uterus is exteriorized, and like in the picture at the top, you could see, or even at the bottom in this diagram, that Foley catheter is placed near the base of the uterine horn, and then we use an IV catheter at the tip of the horn and flush with media from the tip of the horn to the base of the uterine horn. And then that media is collected in a conical tube. Within that, we search it for embryos. Embryo flushing is a great use for live cover or even fresh chilled semen. We can use it with frozen semen. We just don't get the best results. On average, you're going to get 6 embryos per flush per donor, but you have those outliers as well. You can have those ones that do super great where you're in the high to mid 20s, or you have donors that bust. But on average, 6 transferable viable embryos are usually produced with embryo flushing. If we want to use frozen semen, or if you have a doe that's not really fertile, she doesn't ovulate well, or has had a uterine infection where she can't get pregnant, or in some cases we do prepubertal, so those does that are 6 to 8 months or pregnant. In vitro fertilization, or IVF, is our most advanced procedure, and it's one that I routinely perform at Transova. It's a laparoscopic procedure, so unlike flushing, this is just like our laparoscopic AI to some extent. There's 3 tiny little holes. We put our trocars in, and then we use a vacuum pump to collect those mature oocytes from the ovaries, and they are then fertilized in a lab setting. So a needle is mounted onto a pipette, like I said, and there's a vacuum pump. So you can see in that bottom photo, that needle on the pipette is mounted, and then you're just aspirating those mature follicles. So they look kind of like purple pimples on the ovary. And that's the best layman's way to describe it. Those are our mature follicles. So on this doe in the bottom right, she's got approximately 20 follicles between the side that you can see on the front and the back side, and that's just one ovary. Those oocytes are then matured for 24 hours. They're then fertilized in a petri dish and cultured for 6 days prior to transfer. So on average, with in vitro fertilization, we get about 5.5 embryos per donor. But like I said, it's a great opportunity if you want to use rare or low motility, or just in general frozen semen. It seems to perform the best. We aren't relying on that doe to ovulate on her own, and we just have a more guarantee with this process to make something. So whether it be embryo flushing or IVF, what do we do with those embryos? So those embryos are usually transferred from the donor female into a recipient or a surrogate. This happens when those embryos are 6 days old. So in that top right corner, those are all embryos. We see beautiful blastocysts, a nice cell mass. Those, especially this embryo at the top, it's already hatching. It's ready to go. That baby wants to implant. It wants to grow. So our recipients are synced with the donor. So when she comes in heat, those recipients are in heat. But the key is recipients are never bred. If you breed your recipients, then she's going to have her own natural baby. She's not going to carry those embryos necessarily. So she just gets passed over. But on day 6, we look at those ovaries. we make sure there's a CL present. And then this is also using a laparoscopic technique. So we want her to be in that same cycle as that donor was before we put those embryos into her. Each recipient then finally receives, on average, 2 embryos, which are placed directly into the uterus near the tip of the horn on the same side of the CL. It's a minor invasive procedure, so it's mostly laparoscopic, but at the end, we do exteriorize that uterus. In the bottom photo, you can't really see it, but I have the tip of her uterine horn in my hand, and then we use a Tomcat catheter, which has the embryos in there, and then we inject those embryos within the uterus. And so those embryos then float around in the uterus for a couple days, start growing, and then implant, and that surrogate carries those embryos to term. So these are kind of our major advanced reproductive technologies that we can offer. But honestly, reproductive technologies can range anywhere from as simple, like I said, as AI, all the way up to these advanced procedures. They work for every herd. It just bases on your goals, what you would like to use, and how any of these technologies can help, whether it means achieving new genetics in your herd or replicating that female and her offspring within your herd to increase production. So if there's any questions, I'm all ears.
Do we have any questions in the classroom? If not, thank you very much, Dr.
Go
Taylor.
ahead.
Go ahead.
On those advanced techniques, is that only, or?
So with anything, because these animals are under anesthesia, it is recommended to be a vet procedure. There are some states where lay people will do lap AI and embryo flushing, but at this point, because IVF has to go through a lab, Transova itself does require a vet to be performing those procedures. It is the safest to have a vet, but not every vet is trained to skillfully do the procedures. So really looking into kind of who the person or technician is behind the work and what their track record is, or what their success rate has been, really can help determine if you're going to have a good outcome or not, or if you're going to have any complications or not. So with flushing, one of the biggest things is the risk for a hernia. So I do recommend a veterinarian if you're going to surgically flush. There are some guys that aren't veterinarians that do flush, that do fantastic jobs, but there are a lot of them that don't know how to do proper sutures. So that incision, which is about 3 to 4 inches long, sometimes doesn't close up all the way and you'll see hernias. So that's where I recommend a vet to do those types of procedures.
Thank you.
You're welcome.
Any other questions? Hearing none, thank you very much, Dr. Taylor. We appreciate the information you shared with us. And in just a few minutes, we will be moving on to our next presenter.
Thank you, Fred. Appreciate it.